Hey guys, it's Dr. Manny. In this video, we're talking neuropathy treatment options. So what is the treatment for peripheral neuropathy, right? I'm gonna kind of highlight some of the options and then the related pros and cons to each of them. So medication, that's the most common, where somebody goes in, they have numbs, tingling, pins and needles. Okay, here's Lyrica, here's Neurontin, here's Cymbalta, here's some type of chemical cover-up to hopefully take away the symptom, but it doesn't address the root cause, you guys. And it has side effects. Like I've already mentioned that in other trainings, but look at the side effects. So if you have a symptom of balance issues, like neuropathy can manifest as like balance issues, you can't feel your feet, there's numbness and tingling. I take a medication that has dizziness attached to it as a side effect. Does that make any sense? All right, so with that, with the medications and chemical cover-ups, you have this stuff: constipation, diarrhea, fatigue, headaches, nausea, sweating, vomiting, it's just dizziness for several of these, confusion. Some of these are actually worse than damn neuropathy by itself. So medications, right? Side effects, doesn't address root cause. Supplements, okay, better in my opinion, better path, but a lot of times it's guesswork. So you'll see, surfing Facebook, there might be a neuropathy supplement and it's got B12, it's got B1, it may have some herbal stuff in it. Worth the shot, worth the gamble, but it's guesswork, right? It's not looking. What we do is we find out where you're depleted, where are you deficient, and let's put you on what you need to be on. Like I tell patients, the most expensive vitamin is the one you don't need. Right? If you're not deficient in B12, you don't need to be taking a bunch of B12. You know what I'm saying? So we find out where you're deficient, where are you depleted, let's fill in the gaps where we need to. So the most expensive vitamin is the one you don't need, and the most expensive vitamin is the one that doesn't work. I can't tell you how many patients have come to me, they dump a bunch of pills on my desk and it's vitamin D and it's this and that. We test and they're actually deficient in what they're taking. So in other words, they're taking a placebo. They're taking a, bunch of fillers and toxins, and the FDA does not regulate the supplement industry. So what's on the label might not be what's on the label or what's actually in the product. Okay, so supplements, again, that's a better path than the medications, but again, it's guesswork. And what we like to do is test, find out where you're depleted, let's fill in the gaps where we need you with high quality supplementation, where we know we can do a pre-test, put you on a protocol, and retest, and we fix those levels, or we fix things. Manual therapies. Now, if we have a bulging disc, a herniated disc, sciatica, carpal tunnel, okay, manual therapy. Now we're talking spinal decompression, chiropractic, PT. This is all good stuff, right? This stuff typically doesn't have side effects other than just maybe some achiness, some soreness to go along with the mechanical type therapy. So if the problem is physical in nature, like I have a compartmental type issue that as being the root cause, then yes, this is the path you want to go down. So if you have a herniated disc, let's say you have an MRI, and you have some type of disc bulge in your neck, brachial plexus, something like this, or carpal tunnel, then that stuff needs to be addressed mechanically. So if you have carpal tunnel, it's an issue here, and you take a bunch of medications. I mean, you cannot take a chemical to fix a mechanical problem. Doesn't make any sense, right? You cannot take a bunch of medications to cover up a mechanical problem. Like I have a herniated disc, and I'm going to take a bunch of chemical cover-ups to fix my herniated disc. No, you need to go down this route of decompression. So guys, these are kind of the main bullet points, but we have a protocol that works very, very well for neuropathy. Safe, natural, highly effective, but it starts with nutrients. Okay, where are we depleted? Let's fill in the gaps. We focus on diet. Let's reduce inflammation, get your blood sugar under control, because there's a diabetic component. I've talked about this in other videos, and I'll put some resources beneath this video if you want to look towards the causes, because if you want to find the solution, you have to fix the root cause, right? You have to determine what that root cause is if you want to fix this bugger once and for all. So we look at diet, we look at foods and nutrients and toxins and bad fats and inflammation, and we look at autoimmune. Is there a gut component? Is there an immune system issue that's attacking the myelin sheath? So again, we dig. That's a beautiful thing about functional medicine, you guys, is that we dig. Not just so I'm going to spend 5 minutes with you and here's a chemical, I'll see it, and now I'm on to the next patient. That's the broken medical system. You have to stay away from that. Do that as a last resort, right? Exhaust all other options first before going down that road, okay? So All right, guys, I'll leave it at that. I'll put more resources beneath this video. We have a private neuropathy Facebook group. Feel free to click that link and head on into our group and say hello. Tell us where you're from. Be happy to connect with you and see if we can help. So, all right, guys, thanks for watching, and I will see you next time.